Alright, well, welcome back to the channel. This is my first YouTube return channel video after my accident. So my speech is a little bit altered. I did have a surgery on my arm and three surgeries on my right leg, and a surgery on my tongue, and I'll tell you pretty much all that I remember and what happened since late April when I was, let's just say, because there is a lawsuit, let's just say I got into an accident while going to a group ride that I always go to on Sundays, and I was struck by a vehicle and a motorist, and so I was hit on my head, or landed on my head or face or something. I had what the therapist calls memory amnesia or injury amnesia, because I hit my head during the accident when I was riding my bicycle, and I had a brain injury, and I broke my arm in two places. That's why I have surgery. I have titanium here, and on the other side here I have titanium, and I got some scarring on my arm as well as my leg. Let me turn on the AC. Sorry for the sound. Yeah, and I scarred my chin and part of the bottom of my lip, and this arm as well. I have a scar, and I have some scars on my left leg, and I have a lot of scars on my right leg, and I had 3 surgeries on my right leg. And so I was to my memory, it was a Sunday morning. I was biking to a group ride, and a vehicle hit me. I don't remember, because I have accident amnesia. This is also the surgery on my tongue. I lost my tooth. This tooth is forward, and it's been tested. It is the nerve is dead. So these 2 teeth, I'm gonna have a bridge to fill in that gap. And then if my mouth, if I handle it for about 1 year, then my dentist will talk about surgically implanting a tooth here. Right now my voice is altered because I have this big gap, so I'm doing a lot of YouTube tongue twisters and things like that to help with my pronunciation. But my pronunciation used to be actually a lot worse when I had a nodule on the tip of my tongue, because when I crashed or got hit, I had bit my tongue or something, and I had surgery on my tongue to remove it, and it took several days to heal from it. So this is what my tongue looks like after surgery. So there's a little bit of a divot where the nodule used to be. It was on the tip of my tongue, and it felt like a permanent tongue ring on the tip of my tongue. And I've been shaving with a rechargeable shaving razor because it's kind of easier to wash my face and do things when I was in the hospital and now without the long beard. But you can see the scar from on my chin from when I got hit, and I'm healed from that. So using the electronic razor is easier than using the shaving razor, because at the sink I can't stand for that long because I'm using mostly my left leg that has some scars but never got fractured. My right leg, I had 3 surgeries and 2 fractures below the knee. Maybe in my next video I'll show my fractures and scars and things like that, and where has the cyborg been? Where has the cyborg been? Yeah. So I've been watching a lot of YouTube to get my mind off of not being able to bicycle right now. I ordered some parts off Amazon and eBay off of Redshift Sports. They have a shock absorbing stem and seat post, and my wrist and my hand are a little bit sensitive to impact right now. So maybe when I start riding again, or when I get approved for riding again, it won't be as jarring on my skeleton, because it's already August. I don't know the exact date, but I got injured late April. I was in the hospital for a month. I was in a coma at first for about a week. Then I woke up from my coma. I was in the hospital for a total of about a month, and then I got transferred to a rehab facility, and I did speech therapy, physical therapy, and occupational therapy there, which is for the mind, speech, for the arm or hand, occupational, and physical therapy for the lower body, for the legs, gaining strength where you broke a leg. So I did all those 3, and I graduated. I was there for about 3 weeks, and then I graduated Um, while I was there, it was a little bit boring because there was no one my age. Most people were older, like they were recovering from a stroke, or stroke victims, or people who were on, like there was a person, I think in his 20s, but I think he was there because he was doing illegal substances and he got hurt. So we had nothing in common. Yeah. So long story short, I also had I think I had a psychiatrist there too, who was trying to prevent me from becoming depressed or showing signs of depression, things to be productive with my psyche, my mind. So that's pretty much my life in the hospital and rehab. I don't really remember the hospital. I remember when I got discharged from the hospital and I moved to rehab. I remember almost everything, but rehab, my issues there were breakfast was at 7 and lunch was at 12 and dinner was at 5. So after that, most people around 5:30 or 6, most people who were living there went to sleep. So I was by myself going up and down the hallway in my wheelchair, talking to nurses and just trying to kill some time. So it was rough being in the hospital or rehab. In rehab, I did all the things there. I had a hemi walker and a soft brace that was kind of cushy around my right lower leg, and my left arm I had a semi hard brace that was kind of like a white plastic, and to keep my wrist from dropping, because my wrist kept dropping, so I needed something to help it keep it straight. Right now, my new brace with my occupational therapist that's outpatient, because all my services since I've been discharged, all my services are outpatient. So I had speech, occupational, and physical, but I have since recovered in my mind, so I don't need speech anymore. I have graduated and I kept getting all the answers correct as far as my memory, and they did an exit interview and I passed, not with flying colors, but my memory just got better overall. I can still remember things like before my injury from elementary, high school, my bicycle racing life, but I am more patient, more kind, more loving now than I was before. So my demeanor little bit changed. So you might see some changes in my videos on YouTube. Right now I'm still doing physical and occupational therapy outpatient. So what's new is I got a arm brace that covers from the top, and it helps me keep my wrist straight, and it helps with these two fingers to keep straight, because I had some type of nerve damage in my arm. All these three fingers used to be bent down, and only these two fingers could form a L. And so in order to grab things or a cup or open a jar, I would have to reach over it and then drag my fingers to grab the item, because I couldn't reach and extend out. But now I can with my pinky and these fingers. I can almost reach out. So I'm getting a nerve specialist test for these two fingers next week, so we'll see how that goes. But so far my hand, it stays straight and open. It's just these two fingers can't extend all the way. That's the difference. A lot of people, to change the subject, a lot of people have visited me at my house and gave me good words of encouragement. Different cycling teams, old cycling teams I used to bicycle with, they came to visit me. People who got injured before and are now recovered came to visit me, and people visited me when I was at Rehab, the Rehab hospital. My brother, my cousin, my auntie came to visit me. Some good friends I did the 300-mile ride with came to visit me. So it was really good. I'm having a lot of support, and especially from my wife. My wife has been by my side this whole time. I missed my son's graduation from preschool, but I got to Skype and see the video version of it. My son now, starting yesterday, is in kindergarten, and so I got to see him enjoy kindergarten. Not physically go up, walk to the classroom, because I can't walk yet. I can hop, that's about it. But we're doing a lot of positive things to stay positive. Like, I'm reading more to my son, reading books, watching movies with my son, just having a lot of good family quality time, which is good. I was always too busy before when I was riding my bike. And we're also doing retail therapy, so a lot of shopping at Ross, TJ Maxx, the mall, Foot Locker. Yeah, so I got some new threads, and it's positive. I went to one party during COVID recently. It was a going away party, and that was good. Had some good times with friends. Met a lot of old friends and got to hear their stories, what they're doing during COVID and things like that. So there's a lot of positive things that can be done during recovery time or rehab. So stay strong. I want to give some positivity out there. And if you've been hit by a vehicle and you're still alive, consider it a blessing, and just keep praying, stay positive, enjoy family time, shop for new things, recreate yourself, and keep doing your rehab. You can rebuild yourself. I've been approved to stand 50% weight bearing on my fractured leg, and it's August. So it's not all down, it's not all doom and gloom. And I'm gonna have the bridge for my teeth soon. So stay positive, don't give up hope, and just be happy. Yeah, that's all I gotta say. I'm missing a tooth, and I got a cracked tooth that's facing forward, and I got some sensitivity where I had my facial fracture. But be positive. I'm still alive. I'm happy. I got my family. I got you guys watching this video. So anyone who's been injured by a vehicle, just know there's positivity out there, and be positive with your life. That's all I have to say. From the cyborg, signing out for now. I'll catch up with you guys soon. Peace. Let me see if I can do the peace sign with my fractured hand. There. Peace with a thumb help. Okay. Try to be positive and laugh as much as you can. Bye for now. Adios.